Hi, myself Sujit. She's my wife Jisha and she's my daughter 𝐾𝐫. We came to 𝐴𝐿𝑠ℎ𝑎𝑟 Hospital Fujairah to just have a visit. It's a casual visit to Dr. Khalil, and he came to know that my baby is facing a severe bronchiolitis pneumonia, and it's not favorable for that situation, and she was ventilated for 4 days. And by God's grace, now she is doing better, and hopefully by end of the day she will get discharged.
Hello, good day. I'm Dr. Mohammed Khalil, consultant pediatrician and neonatologist in 𝐴𝐿-𝑠ℎ𝑎𝑟 Hospital, Fujairah. Today I will speak about a little bit young fighter, pretty young girl. She's about 12 months old. She is 𝗘𝐀𝐀 actually, born in India. Came to the clinic initially with symptoms of upper respiratory tract infection, very mild, low-grade fever, and otherwise she was fine. Later, 2-3 days, I believe, she was brought to the hospital in March. She is severely agitated and pale, so with high-grade fever. Esther was really in very bad condition at this time. This condition in this kind of case, like preterm 24-weeker with a very little lung reserve secondary to her prematurity, is quite serious. She followed very closely in the intensive care, of course, with repeated blood gases, chest X-ray, showed infiltration characteristic of bronchiolitic condition with markedly inflated lung at this time. 2 or 3 days, we decided to replace the intratracheal tube and to send the end of this intratracheal tube for culture. Unfortunately, the culture came positive for a very bad organism called Klebsiella pneumonia. So there is profuse, huge amount of secretions coming from all of her respiratory tract, and of course, she was not able to feed. We inserted the nasogastric tube for her, and we fed her during this time with this one. So finally, we are able to control her. We successfully treated her with conventional ventilation without the need to high-frequency oscillatory ventilation, which is higher mode of ventilation. And gradually Esther started to show some improvement. Now currently she is in the ward, discharged from the ICU and completing her antibiotic course for the Klebsiella pneumonia. So thankfully, alhamdulillah, today Esther is in very good condition. We have been supported by all the great staff in our hospital, including the doctors in the intensive care and the resident and the specialist looking after Esther with me, and the great nurses which really worked really sincerely from their heart to get her cured. Everyone in the hospital was quite sincere with her condition. Parents, alhamdulillah, I think they are very happy. They were extremely anxious, and I know how they were. And myself was extremely anxious at this time as well. It was very critical, very hard time. Now it's over, and we are all very happy.
So we express our sincere gratitude, thanks to Dr. Khalil and the entire team for their support.
Thank you very much.